Hi guys, my name is Miss Jo and I am a pediatric nurse and I work at Texas Children's Hospital. So that means that I take care of kids all day long, just like you. So what does a nurse do? Well, nurses do lots of different things. It depends on what kind of nurse that we are. But almost all the nurses, we use our senses to help figure out what's going on with our patients. So did you learn about your senses? Let's see, what are the 5 senses? So there is touch, we touch things, and there's taste with our tongue, and there's smell with our nose, and there's listening with our ears, and there's looking with our eyes. So when a patient first comes to me, the first thing I do is I look at them. Yep, use my glasses and everything. And I'm looking to see not only the color of their skin, not like brown or black or white, but what I'm looking for is if it has pink undertones, because that means they have good blood flow, and it also means that they're breathing easily and that it is getting oxygen everywhere in the body. Also, I'm looking to see, are they happy or are they sad, or maybe they're having trouble breathing. And so that's one of the things I first look for, okay? So that was eyes. So the next thing I look with is, well, probably my nose, because I can smell you from a while away, which is why you always need to take a shower. But sometimes our nose tells us things about patients, because sometimes if their blood sugar's too high, they can get off a weird smell. And there's a few other diseases that have some smells that go with them that sometimes tells us immediately that something's wrong. Okay, so the next one going down is taste. Well, guys, I don't use my sense of taste when dealing with patients. That'd be kind of icky, so we're not doing that. The next one is touch, right? Because sometimes if somebody has a spot that looks bad, you lightly touch it to see if it's warm, if it's swollen, if it, has a lot of swelling and bumpiness to it. That can tell us a lot of things. And last but not least, I'm gonna use my ears. And most of the time when I use my ears, I use this wonderful thing called a stethoscope. Now, what is a stethoscope? Well, how many of you have headphones at home? Almost all of you. So these are like special headphones, but they go into my ears, right? And then I use this part to put it over your heart, and I listen to your heart sounds, and those or they should sound like lub-dub, lub-dub, lub-dub. And then when I'm done listening to all the spots of your heart, I move on to listen to your lungs, because it should sound like but every once in a while, there's a few extra noises in there, and that might tell me what's going on and why you're having trouble breathing. So, what is a nurse? Lots of different things. But we start off by using all of our senses and being a body detective to try and find out what's wrong with you. Now, nurses, just like teachers, don't work by themselves. Your teacher doesn't work by herself. She has a principal and a vice principal and a librarian and maybe a music teacher and a lot of other people. When I go to work, I have a doctor and a respiratory therapist and a child life therapist, because no matter where you go, people work in teams. So it's really important that you learn how to work in a team and work together with people. All right, I hope this helps. Y'all have a great career day. Bye.